question was, is there a financially viable billing service for public hospitals? Um, it's it's a good question, and it's a very reasonable question. The problem with New South Wales, at least, is that in New South Wales, it's mandated in the award that all of the private patient billing that gets done by staff specialists in the public hospitals gets done by the local health district. So it's explicitly stated in there that we cannot use any outside billing service. Now, there are some additional complexities with the setup in that, as I'm sure you know, New South Wales is transitioning to a centralized billing model where all of the local health districts are now going to um, get transferred to health share basically, and health share is going to provide all of the billing services starting from a few months from now and getting rolled out over the LHDs, I think beginning or finishing up beginning of next year, where it's all going to be done centrally by health share. And at the same time, the SDPR is getting rolled out. But with regards to using outside software, what's clear is that the actual billing that goes to Services Australia needs to go to PBRC, so that'll be through the centralized New South Wales Health billing. In terms of how you could potentially approach that, um, we have given people options or departments options where they can use our software, for example, or other software that's out there commercially where the software doesn't communicate with Services Australia. It just generates CSV files with the item numbers in certain formats that can be ingested by PBRC, by the billing software directly. So you could use an alternative like that. Some departments I have heard, for example, are using outside billing companies like, now I won't mention any names, but other billing companies that provide these services that can generate invoices for them, and they give them the item numbers, and then the companies generate the appropriate fees and fee schedules and any additional information that needs to go with the items, and they submit that to the billing department. There's actually some provisions in the staff specialist right of private practice arrangement documents for us to be able to use some of the funds in the number one account, although I think it's only to the tune of maybe $5,500 a year that you can use for any sort of accounting or admin that goes with administering the funds. And there's actually a possibility to draw funds from the number two accounts as well as an additional allowed expense, which is any sort of costs that are associated with generating the of the income through right of private practice. So there is a potential that you can actually use either the number one account or the number two account or both to pay for these services. I mean, where I would start initially is probably having a look at what you have at the moment and where really the pain points are and where the significant losses may be, and then just take it from there and try to build either software or sort of processes around that.